So good morning and thank you for coming to our review and discussion for your Rethink Vape MSc4 credits. What I'm going to talk about today is coding and billing. We did a pilot project, as I've mentioned before, using the AAP guidelines for coding and billing, as well as working in conjunction with physicians and office managers to try and come up with the best way that you can do this and practice still get paid. So this isn't a definitive list. This is the best advice that I have to give as someone who is not a physician and doesn't work with the billing and coding system. So for specifics, you should probably talk to your practice manager or biller so you can work out the appropriate codes that you can use. Everything that I'm going to present, I got from the AAP. This is not something that Rethink Vape team created. So here's the source, and you can click on the link. It will take you directly to the AAP site as well. But let's talk codes. Okay, so any Z code can be used, and there are examples of this and other specific counseling. Example is the first listed or only diagnosis, and secondhand exposure, anything you can think of that you're talking about, the Z codes, you can probably find something that works there for you. We were told that the risk counseling is usually already bundled into a well child checks, especially I would think such as the HEADS assessment. If the well visit plus a diagnosed vaping disorder, you can bill both a well child visit and a sick visit because you established that there was a nicotine disorder. Other codes such as F17, in that whole series, it's talking about electronic cigarettes, specifically vaping devices. If a patient has lung injury, for example, you can use that code. There are specific e-cigarette codes for use by your patient, but they're only for teen patients. They're very specific that allow you to base this coding on how long you actually spent talking to them about it. If it was just a question of an 11-year-old, obviously that's not going to take a very long time. But if you have a high schooler who can't get through a school day because they need to stop and go to the bathroom to vape, then obviously that's going to take longer and can use a different code. We took these vignettes or examples straight from the AAP website to give you an example of a typical patient and how you might code for billing. So Violet is 16. She's just there on a well visit, but she's vaping 5 to 6 times a day. So you want to talk to her about the health impacts. You want to discuss quitting or counseling. So now what? So listed below are some codes that could work. Once again, this is our best estimate of what works rather than these will definitely work. Same thing here for John. John's a little younger. He's in middle school. It's a follow-up visit and mom has some concerns. So he's brought in with this addiction being part of the problem, part of the reason you're seeing him, as opposed to Violet, who was just in for a well check. Gives you lots of different codes for nicotine dependence because obviously if he's using 5 times a week, there is a dependence there and not as a sick visit diagnosis. Jeffrey, age 2. So it's a well visit, but you find out in the course of conversation with mom that she has moved to vaping devices as opposed to traditional cigarettes because she thinks this is going to help her quit. So explain to mom that vaping devices are not an approved cessation device and that the child being around the secondhand aerosol or the third-hand aerosol, remember that's going to be on surfaces. It can impact the child's health just as much as being around mom when she was smoking traditional cigarettes. So you're going to have to code this as advice to the householder rather than advice to the patient. But it is a really good conversation. Praise mom. She's doing something to help her child. That's terrific. And then provide her the guidance to do that more effectively. In this vignette, Zach's 15. So middle school or beginning of high school. It's a well check. And he's tried vaping, but he's not using it regularly. And he totally says he's not doing any cigarette smoking. So talk to him. Talk to him about potential dangers and health hazards, how incredibly addictive nicotine is, and that it can lead to future cigarette use. So this is a routine visit with abnormal findings, and it gives you the different codes you can use. Once again, all of these resources are from the AAP, and you can go directly there. Links provided, of course. Please talk this over with your practice managers so that you can keep your lights on at the practice and help teens out at the same time. Thanks.